Well, Black History Month is a time to honor strength and legacy of the Black community, and that includes focusing on health. Heart disease and stroke disproportionately impact Black men, with hypertension playing a major role. So we're continuing our conversation about how to prevent the health risks. We have Dr. Lonnie Sullivan with Cone Health continuing this conversation with us. For those who are just joining us, why are Black men at a higher risk for heart disease when it comes to hypertension and stroke?
Yeah, so unfortunately, Black men have the highest incidence of high blood pressure of any racial or ethnic group. And a lot of it has to do with poor access to healthcare, as well as poor awareness. As I was kind of mentioning before, high blood pressure is something you don't necessarily feel until it's too late. And if you're not getting a preventative evaluation by a physician, then it may be too late by the time you find out you have complications related to high blood pressure.
Since high blood pressure is this silent killer, what are some signs and symptoms to even look out for?
Yeah, so if you have really elevated blood pressures, then you can maybe start to get a headache, you maybe start feeling more fatigued, but usually that is at the sort of tail end of high blood pressure. If you have just mildly elevated but still too high, you may feel nothing. And that's kind of the scary thing about high blood pressure, is that it usually has to get way out of hand before you develop any symptoms whatsoever.
So what can folks do now or early on in order to help prevent this? What are some more lifestyle measures they can take?
Yeah, so one thing us as physicians will always mention: diet and exercise. Those are the two most important things an individual can do to reduce their overall blood pressure and overall cardiovascular risk. So maintaining a healthy weight, and then exercising. The AHA recommends 30 minutes of aerobic exercise 5 days a week. And so I always tell my patients, as long as you are putting your best foot forward and trying to stay as active as possible, that is always better than doing nothing, right, and being sedentary. And then you really want to watch your salt intake and achieve less than 1,500 milligrams a day, if at all possible.
Earlier we were talking about access to care and access to maybe even making an appointment to know your numbers. What advice would you give for people at home as a way that they can navigate and even find out what's going on with their body?
Yeah, so, outside of, I always recommend you go see a primary care physician first, or even a cardiologist like myself. But, even within pharmacies or grocery stores, they have blood pressure machines, and you can either buy them for at home or use the one that's local to get a sense of what your readings are doing. When we look at the data, patients that take their blood pressure at home consistently, that gives us a more accurate assessment of their blood pressure than a one-time office visit once a year. So I always empower my patients to get their own blood pressure cuff, keep track of things at home, and then send me back the data when they see me. So even if you don't have direct access to a physician at that moment, you can do your own blood pressure readings at home or in a local grocery store or what have you.
I want to talk a little bit about age. When it comes to other illnesses or different cancers, we're seeing them pop up in younger people. Is this something that you're seeing when it comes to heart disease?
Absolutely, absolutely. It is, high blood pressure. I've seen that of patients of all ages. I've taken care of patients in their 20s with high blood pressure, patients, all the way up to 100 with high blood pressure, right? So, we think of it more as a condition that affects patients as they get older, but it really affects patients across the lifespan. And so I don't think it's too early for any patient to get evaluated, especially if it runs in your family or if you're a high-risk individual like an African-American man.
Anything else that you'd like to add that I may not have asked you that you really want our viewers to be able to take home with them?
Yeah, I think your health is just one of your most valuable assets, right? Poor health changes the trajectory of your life. It changes the trajectory of your family and loved ones' lives. And so it's something that you have to take hold of and take ownership of. And, I understand the legacy of healthcare in this country for us as Black men is riddled with malpractice and abuse against Black people. So I understand that fear. But I say in 2026, you have more African-American physicians like myself and other people that are really interested in this movement to get people healthy, that I don't want you to be afraid anymore. I want you to take ownership of your health and really know your numbers, know your risk, and do everything that you can to reduce that.
Yeah, thank you so much, and we thank you for all that you do and the tons of people and lives that you're helping to save every day.
Absolutely. Thank you so much.
For more of these details, you can visit our website, WFNYnews2.com.